Doctor, thank you for being with us. Tell me right now, what is your main concern as you sit there in Colorado?
Yeah, hello. Well, we started seeing community transmission here in Colorado just over the recent days. And my concern is the volume of cases that we are likely to see in the coming days. This is not leveling off, and this is here to stay.
And what are you doing to prepare for it? There has been an overall sense that if we can slow the spread of the virus, we can prevent our healthcare system from suffering under just too many people showing up, frankly, at the hospital. Does that continue to be a concern?
Well, it has triggered us to activate different levels of our response at the hospital on the hospital side and in our clinics. And so we are screening everybody who does enter our facilities, all patients, visitors, and staff, to make sure we're not importing excess cases. And then our control measures really will be focused on preventing transmission in our healthcare settings to our healthcare workers and to our most vulnerable populations in Denver.
But are you ready if there was a flood of cases?
Well, we've been preparing for years, and we are ready for to surge. The number that takes on, we're all going to have to work together as a healthcare community and surge where people can help each other out.
Do you have enough test kits? And do you have enough masks and other things that your healthcare workers need to conduct daily business?
We have dipped into our stockpile of masks. We are concerned about our supply chain. We are taking measures, again, to utilize our equipment to prioritize those at most risk. But we will need more supplies. We do have test kits, but the turnaround time is still slow.
What does that mean? How long is the turnaround time? If I were to walk in with a fever, thinking that I very likely had coronavirus, how long would it be until I actually knew?
Well, it's looking like between 24 and 48 hours, but ideally we would like to know sooner. And the sooner we know, the sooner we can implement control measures on known positives.
Right. And what happens to those people who do walk in right now and it's 24 to 48 hours? Are they free to go home? Are they spreading the virus conceivably without being aware of it?
Well, we hope not. Our directive is if they come in with symptoms that are consistent with coronavirus, we will put them into isolation just as if they were a positive case. We will obtain our test and we will send them home with a quarantine directive until we know the results.
And what is your expectation for what's going to happen over the next few weeks, Doctor?
We're going to see a surge in the number of cases. We're going to see a lot of people getting tested. We're going to see a lot more positive cases. And we need to protect our most vulnerable and so that we don't see the death rate that we have seen in other places of the world.